Hello, my name is Dr. Lesya Vastruk, and I'm the Compliance and Education Specialist at Prep Doctors. And today I have the pleasure of speaking with Dr. Pallak Razdan. You know, you have exams ahead of you, right? And we were, I'll say, for our audience, we were talking off camera before. No, so exams are always stressful.
Yes.
Right? And I've been an invigilator for the NDEB exams, and I could feel the stress in the room. I could see the stress on the faces.
I'm sure you could cut it with a knife.
Yeah, you know, and our role really was, you know, specific. We couldn't maybe reach out in the ways that I would want to as a human being. But I remember the stress of the high stakes exams that we had in dental school, and I think that the strategies. Can you give me an idea of what strategies you have used successfully in the past when you've been in an exam situation to help with the stress?
I generally am a big nervous wreck, to be honest, but I guess I've sort of, and I think everyone has their own ways of handling stress, and they know how they sort of do best for themselves, right? But I have tried always to just, I think before the exam, just like big breaths, and just sort of, you know, tell myself that it's okay. It's not the be-all and end-all of life, although it is with these exams. And I mean, the whole sort of financial and like mental stress that you have taking these sort of career-altering exams. But yeah, I think in that moment you have to tell yourself that nothing is more important than yourself. Because if you're going to make it out of this alive, that is when you're going to be able to take the next exam, right, and go further down the route. So just keeping myself centered and like just trying to breathe. That's the in-exam strategy. But overall, I think it definitely helps to be a part of a community. It definitely helps to have friends who are sort of going through the same struggle. And I feel that like I wasn't able to experience it because I studied by myself and online the entire time. But I'm sure that all those who come here, like all students who come here, have that feeling of sort of togetherness and community, and they can vent to each other about the process and about the exams. And I think that makes a big difference in the long run.
Yeah. I'm sure that it does. And I have friends who have studied here at Prep Doctors, right, who've taken the courses. That's how I found out about the Institute. But when I see today's students, and I say they're students because they're taking courses, but really they're doctors. We call them doctor here. When I see them in the hallway and they're talking with people about the exams they've taken, they're happy to share the results that they have, and I think they cheer each other on.
Yeah.
You know, through the discouraging times, and it's a really nice atmosphere, actually, despite the stress. That you have somebody who's going through
it.
In fact,
when I sort of took the AFK for the first time, I remembered like students from Prep Docs like standing together and, you know, just calming each other down and be like, oh, you remember we did this then, and you remember we did that then, and you know this, you've got this, you know, like don't worry. So yeah, definitely makes a lot of difference.
Yeah, and I've been in social settings with people who've taken courses here at Prep Doctors. So deciding what they're going to do in terms of retakes, you know, because not everybody passes successfully the first time. I just think that's really great, and especially for newer Canadians who may not have their family here. I think that's really nice to find some people who understand. So stress. So we were talking about breathing, and yeah, test taking strategies. So not only are there strategies you should use to manage your own stress, but also the skills of doing different types of exams. You know, do you proceed through the exam, you know, kind of, do you read through it first? Do you proceed through the exam just, you know, answering what you can and come back to the other questions, or you know, those are things that people can learn. And stress management, sometimes people have breathing practices through yoga, sometimes through therapeutic mindfulness classes, like I've taken therapeutic mindfulness classes. So taking a look at how traditions that began in religious practice can actually be helpful scientifically and clinically for stress management now. That was my entry point into that.
I guess that, again, when you're taking these kind of exams, you've gone through high school, you've gone through dental school. you've been in stress situations before, you've taken exams before, and I think everyone has their own sort of test-taking strategies and how to best sort of, you know, like make the best optimum use of the time that they have given, you know, with the exam and everything. So I personally, I like to read the question paper. Like, so I tend to quickly skim through all the pages and the questions, and I just try to get an overall feel of what the exam is like. It's a different thing that if my eyes fall on a question and I don't know the answer, then that question is knocking on my, you know, head at some point while I'm doing another question, and then you have to constantly tell yourself that, listen, can we finish this and then go on to the next one, like we'll get there. And then it just happens that either through another question, or you know, when you're trying to sort of eliminate or you're trying to rationalize why this is the option, you just get the answer to that question, and then finally you're at ease and you can breathe again and you can continue to do the exam. But yeah, that's just how I am and how I do it.
And I think the same thing, the assessment of clinical skills is changing.
Yes.
But I think time management, knowing what you're going to be doing over the course of the exam and planning accordingly, and knowing when do you give up, you know, when do you end your work on this competency and move to the next one. I think that helps you to manage, you know, your stress and also prepare for doing your best for the next competency. What I was going to say is stress in dental practice. So again, you know, how skills are transferable and that. Things happen in dental practice, regardless of your planning, whether you have a morning huddle or not, whether you've read the chart or not. Sometimes things happen, unexpected things.
Right.
So how do you, from your practical experience, and I remember my practice experience also, I think that managing stress, because you want the patient to be able to manage their stress.
Right. I think what's important when, and like you said, you could have a morning huddle and you could have your meetings and you could be prepared right down to the T, and yet something may go wrong, because that's just life, right? I guess just constantly remembering that you're being watched, and your patients are seeing you, and if you're going to be stressed, then your stress is physically palpable to them, because you're sitting in very close proximity as well, right? And I guess when the patient is in their chair, I mean, they are in a vulnerable position. Right. You're operating on them, you're in a vulnerable position. So I guess just remembering to keep your calm and realizing that one of my professors used to say, everything is fixable. Like everything is you can fix it. Right. Maybe not you directly. Maybe you'll have to call a specialist in. Maybe someone else will have to come in and do it for you. But as long as you remember that everything can be fixed, I think that just helps sort of take the nerves away. At least for me, I remember one time, right before we were about to close clinic, there was this really, you know, worried gentleman who came in with a lot of pain in his lower left molar. I will never forget that one case in my life. And he was crying. And you don't expect like a big old man to be crying. I've never seen. I mean, for me, it was the first time. So I had to like physically calm him down and just be like, okay, don't worry, let me have a look. And I could see that he was stressed and he was wincing, with just like, while I was just trying to put in the mouth to examine the situation. And I was getting stressed, because I was like, if I do anything wrong at this point, he's probably going to hate all dentists for the rest of his life and, you know, not come back. And that's just going to be worse, because then he's just going to be in more pain. So then I had to tell myself that, listen, maybe you can't do it, and that's okay. We'll have someone else come in, but just do what you know best. And, you know, just like I had to tell myself, this is fixable. It is fixable. Maybe not by someone else, but it is fixable. So yeah, just that's how I deal with it. So were you able to calm him down? Yes, I was. In fact, he had an abscess, so I had to like drain it instantly and do an access opening as well. So I did it, and it was okay. He was fine. He came back the next day and he's like, he texted me that, like, I gave him my number and I gave him like meds and everything, and I was like, please text me in case you can't sleep in the night or whatever. And he texted me, he's like, thank you so much, and I'm not in pain anymore, and you know, I will come back definitely for my appointment tomorrow and everything. He's like, I've taken my antibiotics, I've taken my painkillers, is there anything more that I need to do? I was like, no, you're good, like just try sleeping. So yeah, I guess sometimes when you're in this whole process and you feel like you can't do it, or you're losing focus and you're just like, what am I even doing all this for, you know? These instances come back and sort of push you and motivate you to just keep going.
Yeah. You're doing it for the people, right? I mean,
Right, exactly.
It really is a tremendous privilege to be able to be in healthcare.
It is.
And to make people feel better, right?
Yeah.
And I think in that moment, you know, it's funny, the technical aspects of what you did, the drainage and so on, you're like, oh, no, I just did that. You know, so you have so much knowledge that really, it took you years to acquire. Managing the patient's emotions is hard, and we may not have learned, you can't learn that from a book, as we've said.
You can't, yeah.
Just through experience and through getting to know and care about the person that's in the chair.
Yeah.
But, you know, you're going to get back to that here.
Hopefully soon, yeah.
And it's a hard process you have to go through with the exams. But there are many people that have done it, who will do it with you, kind of alongside you, and then you can come back here and share your experiences on the other side of it. So I really
yes, I'm actually waiting for that day to come soon. Yeah, that is something that I'm looking forward to. And like you said, it helps to know that there are so many people who've done it before me. There are so many people who are doing it with me, and I'm not alone. I think that is so important to constantly tell yourself, because it's really easy to sort of get into the self-pity mode and go down that rabbit hole where you're like, you know, oh, I'm alone and no one understands what I'm going through. No, just come here and see the other students and, you know, the other doctors, and everyone has so many challenges and they're still doing it. They've still done it. So, I mean, nothing should bring you down, and just like put the blinders on and just focus and just do it.
Yeah, I mean, I find tremendous inspiration from the doctors that are studying here. So when I was making my own decision to go back to dental practice, knowing that other people around my age were starting over in Canada and going through the exams to do it, and practicing again to regain their clinical skills if there had been a gap. Yeah, it's inspiring to me. And I think the other thing too is, you may have those moments where you feel vulnerable. So, as you said, in the hallway or out in the, you know, in the staff room, let's say, if you're in a dental office, you can always vent a little bit there.
Yeah.
You know, the patient needs you to be calm so that the patient can be calm.
Absolutely.
But you can be yourself with your coworkers.
Yeah.
Right? And you need to be yourself with your coworkers, with your team members. And sometimes, you know, it's the other members of the dental team also that can be the ones that are, you know, holding the patient's hand or whatever as you step out.
Yeah.
Right? So I think that communicating with the people that you're in that healthcare environment with is itself a stress management tool, if you know that you can trust them, and vice versa.
I think, and that's the whole, that's the power and the charm of the dental community. I think anyone that has ever been in a dental office in any capacity knows what it takes to run a dental practice and make sure that you're delivering the best care possible, and the patient is stepping out pain-free, happy, you know, etc., etc. So, like you said, just the fact that we're in it together, and we know, like, the whole team knows what it takes to, you know, just make the experience for the patient a very positive one, because a lot of people don't like coming to the dentist.
Right.
I mean, it is a very deep-rooted fear that a lot of patients may have. And just the whole, like I said, everyone in the team doing their bit to just make sure that everything is okay, that all of us are okay as a team, and the patient is okay as well. And that's the power and charm of dentistry, is that everyone just knows how to do it, and it just happens.
Yeah.
It just happens.
So, on that happy note, I'd like to thank you for coming to talk to me today.
It's been a real pleasure. Thank you so much for having me.
And thank you so much for blogging for us. I think that your candor, just your willingness to share the feelings that people feel as they're going through this, I think is really important for everybody to read. And I want to thank you and wish you good luck with your exams.
Thank you so much.
I look forward to hearing from you again.
Yes,
and
hopefully
you to
soon.
Talk to us soon.
Hopefully soon, yes.
Wonderful.
Thank you.
Okay.
Thank you.